Hey, and welcome back. So good to see you again. It's Dr. Yogi, and I am happy to be amongst the presence of greatness today. Thank you for coming by. This vlog is pretty much to kind of document my shifts in the ER, especially during COVID season, because things have changed quite a bit from before. So if you're interested and you want to tag along, stay tuned. All right, good morning, everybody. It is 7 a.m. and I am on my way into my morning ER shift. Typically, our shifts last 12 hours, but I do have a meeting at 5 p.m. today to discuss graduation and what that's going to look like in these COVID times. So I will get off a little early. I will try to take video along the way, but of course not going to do anything that's going to violate patients' privacy. But anyway, I'm heading in. So typically when I'm going to start my ER shift, it can be from 7 a.m. to 7 p.m., 7 p.m. to 7 a.m., or 11 a.m. to 11 p.m. Of course, you can mix it up depending on your schedule to make sure you get your 100 hours. So you go into the emergency room, and right at the beginning, before you can even enter, they do check your temperature to make sure you do not have a fever. If you do not, they give you a mask, and then you can proceed into work. We have to make sure we have a backup supply of special masks that we need to go into rooms with patients who are suspected of coronavirus or have been confirmed positive. And so we all had to get refitted for our backup mask. So typically what I do when I start my ER shift is I sign into the computer, and then I will be able to assign myself to specific patients. And I get their baseline history, look at their vital signs, and their chief complaint. And then I proceed into the room, get my history from the patient, and from there I can determine what labs, what testing, what imaging are required to figure out why the patient is presenting with the problem they are presenting with. I then go and speak to the attending about my plan, see if there's anything that I missed, anything that they might want to add, and I will put the orders in and kind of wait for things to come back. While you're waiting in the ER, you often are doing other things, like you're seeing other patients, following up on the tests you ordered, and that's typically how it goes. It's always something to do. You don't actually have dedicated time to eat. You go grab your food and you come back to your computer, and then you pretty much eating from the computer because you don't want to miss anything like a very abnormal lab that needs a quick response. Y'all, I did not document anything today. Like, it felt crazy in the emergency room today.
Yeah, I'm in my room. Don't judge me, okay?
Some of the stuff I saw today included a patient who came in, was found down by her husband, and had been normal a couple of, like, less than 2 hours before. And when she came into the emergency room, she couldn't really, like, add to the conversation. Like, she was just acting very abnormal and just kept saying her head was hurting. And so we got labs, got a CT scan, and then she was found to have a subarachnoid hemorrhage. If you don't know what that is pretty much where you have bleeding inside the brain. Most of the time this occurs from something like a rupture of aneurysm. An aneurysm is like an outpouching in the vessel. That in the vessel tends to be very weak. Whatever the case may be, we had to transfer her to a different hospital that they have the capabilities to do like neurosurgery. So I'm gonna try to follow her along the way, just doing some chart review to see how things go for her. That was very interesting. Some other things I had was someone coming in with a rapid heart rate, found to having a new irregular heartbeat, what we call atrial fibrillation, and she's going into RVR, which is that rapid response rate, up to the 160. So had to start her on a medication and then do a workup to figure out what caused her to go into this rapid rate. Oh, you know what? There was one that a lady had come in and she had like a lump on her back. And then it started to become painful and red, and she started having high-grade fevers. Her temperature was like 103, and wasn't really responding to Tylenol or Advil that well, so she decided to come in and then we drained an abscess. I was actually able to find the abscess with an ultrasound, which I would tell anybody out there who's doing medicine, or you want to do your path to medicine, if you have a chance, then you can get your hands on an ultrasound probe of any sort, then it's good to practice. But so I was able to locate the abscess with the ultrasound and was able to drain it. And there was so much fluid in there, so much pus. But you know, getting that site of infection cleared is the first step when you're dealing with something like that. A lot of times when people have abscesses, you can just drain them, don't need to put them on antibiotics, and they will do just fine. However, with her situation, she was diabetic, and then she also had this overlying cellulitic component, meaning an infection of that overlying skin. So we did decide to put her on antibiotics in addition to the drainage. We had to pack the wound, meaning we had to put this gauze type material in the remaining space. When you put packing in a wound, if you say that this is the wound here, if you don't pack it, sometimes the wound can close from the top up and then leave that opening in the body. The body will fill that with some other type of fluid, or maybe that infection can restart again. So what we do is we'll open it up and then we'll pack it so that opening will then close from the bottom up. I know I'm trying to do that with one hand, but you get my drift. So, you know, it was an interesting day for certain. I don't know why I was so tired after. But even after that, we did have our meeting to talk about graduation. I know everybody is living in unprecedented times when it comes to things like graduation. You work so hard and then you're stuck with doing stuff virtually, but I want to let everybody know out there, your hard work does not go unnoticed. Your family, your friends, everybody that loves you, your classmates, you know, y'all all, you know, going through that together, and it's still an amazing accomplishment. Congratulations to all the graduates out there. So we are also told that we will be doing a virtual graduation for our residency. You know, it is what it is, but I will keep you guys posted if anything else new happens. I will try to film one of these shifts, but you know, if it get busy, it get busy. Sorry for the quality of this video. I was walking around and it was so dark. I don't know why I decided to just peruse the halls and talk before I left. Some other things that I saw on my various ER shifts included a patient who came in with this vague abdominal pain. We did a CT scan and we were able to see that he had what we call a perforated diverticula. It's pretty much when the colon has an outpouching, it is weaker than the structure when it is at its normal state. And so the outpouching ruptured, and that allowed free air to get into the abdomen. The abdomen is a closed space. It should not have air in it. And so that is what we consider a surgical emergency. So I had to consult general surgery, and then based off of their exam of the patient, they decided if they wanted to do more conservative measures, such as just keeping him on IV antibiotics, or if they needed to take him to the OR ASAP. Inpatient service, the emergency room service, all of that is high yield learning, and it teaches you how to balance multiple things. It teaches you how to prioritize what's important and what needs to be handled now versus something that can be handled a little later. All in all, it was a great month. All right, that's it, guys. I hope you enjoyed it. You know, the emergency room is definitely a place of good learning. I really shout out all of the emergency room doctors, all the emergency room nurses, PAs. Everybody is really, you know, putting in a lot of effort to take care of our patients during these times. So don't forget to like and subscribe if you want to see more content like this. Anyway, it was good to see you guys. Until the next one.